Today, we're going to discuss different ways a person can get infected with coronavirus, how the coronavirus attacks our body, what are the symptoms of the virus, and lastly, when is the right time to go see a doctor. To get answers to these questions, keep listening. Hey, what is up, guys? My name is Mukal Rapal, and welcome to Medicine and Chill. So, let's get right into it. Coronavirus is mainly spread through respiratory droplets of an infected person with coronavirus. These infected particles can spread when a person sneezes, coughs, or talks. Other ways someone can be infected is through a particle known as aerosols, which compared to droplets are much smaller and lighter in weight, so they can linger around in the air for much longer. There are still studies being done to determine how exactly this mode of transmission works. Lastly, there is another way of transmission known as fomite transmission, and what this means is that virus particles remain on the surface of your couch and chair and table and so on, and they can stay there for anyways from few hours to few days, depending on the environment and the type of material the virus is on. And if you were to touch one of these fomite particles and then touch your nose, mouth, or eyes, you could be infected with the coronavirus. Once the coronavirus has made its way in our body, it makes its way down into our lungs. And once it reaches there, it attaches to an enzyme called ACE2 receptor, which then links the coronavirus to the cell. It is believed that the more the ACE2 present in our body, the more the severity of COVID-19. Higher number of ACE2 enzymes are present in diseases like diabetes, cardiovascular diseases, and COPD. So after being attached to ACE2 receptors, it attaches to another enzyme called TMPRSS2, which allows the viral genetic particle to enter the cell. So after entering the cell, the virus starts replicating within the cell. And once it's done, it basically destroys the cell and then leaves. Now, once the person is infected with the virus, the symptoms of virus can take anywhere from 2 to 14 days to develop. The most common symptom that the patient presents with are fever, cough, and myalgia. Myalgia basically means pain in the muscle. And some of the less common symptoms that we see are loss of smell, diarrhea, and nausea. According to a report that included around 45,000 confirmed infection, out of those 45,500 people, 81% of the people had mild disease, which means they had mild fever and cough, and 14% had severe disease, and that was defined as patients presenting with dyspnea, meaning difficulty breathing. And this difficulty breathing was caused due to pneumonia being developed. And 5% were critically diseased patients. These people presented with respiratory failure due to severe pneumonia, and some patients also went to shock and suffered from multi-organ dysfunction. So now that you guys have a better understanding of coronavirus, let's answer when should you seek medical attention. According to the CDC, you should seek medical attention if you're suffering from difficulty breathing, persistent pain or pressure in chest, new confusion, inability to wake up or stay awake, and bluish lip or face. All these symptoms suggest that your lungs or heart are not in great condition, and as a consequence, your body is not getting enough oxygen, and if not given proper intervention, could lead to damage that could have been avoided in the first place. Now, on the other hand, if you're experiencing mild symptoms like fever, cough, and you don't have difficulty breathing, you should contact your healthcare provider first and explain your symptoms to your healthcare provider, and then they will further guide you on what you should do next. And that is it for today, people. I hope the information I provided was valuable to you. And if you enjoyed, please do leave a thumbs up and do not forget to subscribe. And if you have any questions, please do not hesitate to leave a question in the comments below. I will get back to you ASAP. And thank you guys for watching. Have a great day.